Why do we make a fuss about screening? Well, we don't need to worry if there's nothing that we can do. We now have treatment that is very highly effective, very simple, very little side effect, and we can potentially cure people and prevent cirrhosis, liver failure, and liver cancer if we know who they are. Risk-based screening is not very effective because it relies on the physician asking about the risk factors. And you know how busy your primary care doctors are. Asking about risk factors for hepatitis C is not a top priority. There's just not enough time for it. The other reason why risk-based screening doesn't work very well is it depends on the patients recognizing that they had those risk factors. Because risk-based screening hasn't worked very well, the CDC recommended in 2013 that we should actually go with a more simple approach, which is the birth cohort screening, or what we all say, the baby boomer screening.
So screening practices are better, but I'm not sure I would say that they're really working. It's better than when we're purely doing it based upon if somebody had risk factors and seeing if they would tell us about prior drug use. But especially this thing about screening all the baby boomers, I see it happening with certain physicians or with certain hospitals or certain health groups, but really haven't seen it broadly. And it's more than just screening, it's then getting the patients into care, knowing which providers are available to them and really sealing the loop on all of that. So it's not just about identifying the patients, it's actually getting them treated. I'm not sure we've seen that broadly enough. I think there are efforts to improve it through education, and we have a ways to go, but we are making progress.
We know that the uptake has been very low, and there have been several studies that look into it, because once again, doctors are too busy. So how can we make it better? So there are several studies that show that nowadays with electronic health records, you add all these prompts and alerts so that you can build into the electronic healthcare record system, flag everyone born during that period of time, run through the screen whether that person has been tested for hepatitis C. If that person hasn't been tested, give you a reminder. You can even go one step further, that the system automatically puts in an order for you, unless you click delete. The simpler it is, the less steps there are, the more likely things get done.